Sanjiao 16 is located on the posterior border of the sternocleidomastoid on a contour with the angle of the mandible. Palpate along the posterior and inferior borders of the mandible to make sure that you find the angle of the mandible correctly. Then move backwards onto the posterior border of the sternocleidomastoid to find Sanjiao 16. Large intestine 17 is located 1 cun inferior to large intestine 18, but on the posterior border of the sternocleidomastoid. If the person turns the head against resistance, it should be quite easy to locate the sternal body of the sternocleidomastoid. Mark your point 1 cun inferior and then have them relax their neck. Bladder 57 is located on the posterior midline of the lower leg in a depression inferior to the two bellies of the gastrocnemius muscle. To find this depression, have the person point their foot. If you can't see the depression, palpate round, feel the bellies of the gastrocnemius and the Achilles tendon and spiral round until you can find a nice dip. This point is often described as being 8 cun superior to the lateral malleolus. That is, halfway up the length of the lower leg. It's not always there. Please go with a local anatomy to make sure you find this point correctly. Bladder 40 is located at the midpoint of the popliteal crease, in between the tendons biceps femoris and semitendinosus. To bring these tendons into relief, get the person to take the weight of their own leg. It then becomes quite easy to feel these two tendons. It's also easier to see where the popliteal crease lies. When they lower the leg, make sure you mark this point directly in the centre of the popliteal crease.
Gallbladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.
Stomach 45 is the lateral nail point of the second toe. Be sure to mark this point clear of the nail bed and in the flare of the base of the distal phalange. Stomach 39 is located 7 cun superior to prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the width of the body's finger, not your own. This point therefore lies inferior and anterior to stomach 40. Stomach 36 is located approximately 13 cun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cun inferior to the inferior border of the patella. Stomach 35 is located on the lateral aspect of the knee when the leg is flexed. It's on a level with the inferior border of the patella and lateral to the patellar ligament. Stomach 33 is 3 cm superior to the superior border of the patella on a line joining the lateral aspect of the patella to the anterior superior iliac spine. It's half the distance between the superior border of the patella and stomach 32. This is stomach 33. Gallbladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap. Spleen 3 is located in a depression which is proximal and inferior to the first metatarsophalangeal joint. Find the knuckle of the big toe and fall into a nice depression which is proximal and inferior to it. Be careful not to approach this point from this direction, or you may try and find it on the wrong side of muscle. This point lies between bone and muscle. The easiest way to locate liver 8 is to fully flex the leg, place your finger on the medial end of the popliteal crease, open the leg up to 90 degrees and then travel slightly superiorly, that's up towards the head, a very small distance until you fall into a nice dip that is anterior to the tendons of semitendinosus and semimembranosus. It's about 1 cm anterior to kidney 10.
Kidney 10 is at the medial end of the popliteal crease, in between the 2 tendons of semitendinosus and semimembranosus. Locate this with the knee slightly flexed. Kidney 10 can also be found in the prone position. To bring the 2 tendons of semitendinosus and semimembranosus into relief, you can ask the person to push up against your hand against resistance. This will bring the 2 tendons into relief and you can palpate in between them easily.
Liver 7 is best found in relation to spleen 9. Palpate posteriorly along the inferior border of the medial tibial condyle for about 1 cm posterior to spleen 9. There's a nice dip that's liver 7.